Premenstrual Dysphoric Disorder is a common and treatable condition that not a lot of people have heard of, myself included. Tonia Jahshan has PMDD, and she's here to talk about her experience along with the medical director of the Women's Health Concerns Clinic at St. Joseph's Healthcare Hamilton, Dr. Benicio Frey. Thanks very much for joining us. And you were actually the one who diagnosed Tonia with what she says was a classic case of PMDD. What is it? It's not PMS.
It's not PMS. Well, the symptoms are very similar. In fact, they overlap largely. The difference of PMDD and PMS is that PMDD, the symptoms are more severe to the point that impact people's lives, whether it's relationships, whether it's work related, or the ability to function. So PMDD, let's say, is more a severe form of PMS.
Okay, Tonia, tell me about your symptoms.
So for years, I would get these, 2 weeks of the month before my period would come, I would just get this overwhelming feeling of rage. Like I could just feel my whole body tensing up, and there were months where it felt like just complete hopelessness and anxiety and just snappy. I would have to literally, it got so bad, I would write in the calendar for my family to know, this is the 2 weeks before my period. It's not you, it's me, just tread lightly. And then the second I got my period, I could just feel everything just go away. And I said to my husband, like, I can't live like this. Like, it's like I get 2 weeks in a month where I feel great, but then the other 2 weeks I'm feeling like a completely different person, almost bipolar. And it wasn't until I was lying on the floor in the gym and I was on the phone with one of my best friends, and I was crying, and I cried all the time during this period. And she's like, Tonia, go and get help. Go and talk to somebody. So I did, and I was referred to Dr. Frey, and then I had to do all of this monitoring of my mood and my period for about 6 months. And I walked into his clinic, and it was a good 2 hours we sat with each other. And he goes, you have a classic case of PMDD. And I'm like, PMDD? Like, what in the world is that? Premenstrual Dysphoric Disorder. I had never heard of it before.
Right.
And I went on medication. He gave me, I'm on duloxetine, and I feel completely different, like completely different. I get PMS, obviously some symptoms of PMS still, but nothing like that. That was rage. That was a total out-of-body experience for me when I was not on medication. So it's serious.
Right.
Yeah.
And what do the drugs do? Like, is there one kind of like magic fix-all pill for this, or are there a number of symptoms, a number of treatments?
There are different treatments for different people, and people will react differently. But essentially, the medication helps decreasing what we call hormonal sensitivity. There's nothing wrong with their hormones. It's the brain that reacts to that normal physiological hormonal change. And the medications, when they work well, they decrease that sensitivity. So people will still have some symptoms like PMS, but they're not going to react in the same way.
And it's not numbing. Like it's not you're not like a zombie on these drugs.
No, not at all. No, I feel, actually, I just felt normal again. I didn't feel, I own a business.
A very successful business. You've been on Dragon's Den.
Yeah, been on Dragon's Den. So for me, I had to function as a leader, as a mother, as a wife, and that was definitely a concern of mine. Yeah. Am I going to be numbed? Am I going to be a different person? I wasn't at all. I am not at all.
Yeah. And super encouraging, and we want to get more people to talk about this, is that the Women's Clinic at St. Joseph's up on the mountain, Hamilton Mountain, you don't need necessarily a doctor's referral. You can go there yourself, you said.
That's correct. You can either be referred by your doctor, or you can self-refer. So if you go to www.stjos.ca, you can follow the referral information and then self-refer yourself to the clinic.
That is amazing.
Yeah.
I think that all women listening to this today, knowing that if you feel this, I think when you know something's not feeling quite right, to have that option to self-refer yourself, I think is incredible. And I think all women should go and self-refer if they feel that way.
Right, and that's why we wanted to have you on the show, because we want to get that conversation started, right? Like, don't be embarrassed.
No.
Don't think, oh, I'm the only one like this. Get help if you need it, and we'll get all the links up on our website, chch.com.